very good morning to doctors and my fellow friends. Hope you guys are doing well during this MCO break. And we are from Group 8 and going to present about the case scenario regarding a talkative patient. First of all, let's start with introductions. What is communication? Communications, the origin of communications comes from Latin, which means to share. Communication is a process of sending and receiving message through verbal or non-verbal. We can define a communication occur whenever the behavior of sender influences the behavior of receiver. So the constituent of communication includes a sender, a receiver, and a channel of communications. There are two types of communication, which is verbal communication and non-verbal communications. Verbal communication is normally used in daily life. It transmits the message through the spoken words, and we can express our opinion or feeling in the form of speech, discussions, presentations, and conversations. Next is non-verbal communications. It communicates without speaking, like gesture, face expressions, and body movement. In our daily life, non-verbal communications seems to be more noticeable as compared to verbal communication.
Hello everyone, we are from Group 8 and we would like to present our case scenario. The patient case is a 59-year-old diabetic patient is maxed out on the oral diabetes medications and is told by his doctor that he has to start insulin injection. The patient is then referred to the pharmacist for education on insulin injection, but he is a very talkative patient.
Good morning. What is your name, sir?
Good morning. My name is Benji. Did you watch the movie called Benji? The dog is a very cute dog. You should watch that movie. It's about a dog who comes to rescue and help a broken family when the boy and his sister stumble into a serious danger. I recommend you to go to watch the movie, and I also have a pet dog in my house.
Alright. We are really under schedule here, and I am assigned by a doctor to assist you on how to start and adjust the usage of insulin. So,
Okay, I really don't mind getting injected, and I'm also not afraid to be injected or to inject myself with insulin. My mother was also a diabetic patient and she was also injected with insulin. You know what? My grandfather was also a diabetic patient. I was diagnosed with diabetes at the age of 51, but now many young people are being diagnosed with diabetes. I think this is because of
right, sir, since you have seen your mother getting injected with insulin and your grandfather, right,
yes.
also a diabetic patient, so I assume you know all the procedures of the injection. So I will make it short and simple so that we can save more time for the next patient. Okay. So firstly, you can inject your insulin at 3 different parts of the body, either on the stomach, the buttock, or at the back of your arm. But you should only choose one of the parts because each part will absorb insulin at different rates. So for your case, I would recommend you to inject the insulin into your stomach at night before going to bed. So,
Oh, I think I better put a reminder in my phone so that I remember to do because I keep forgetting things nowadays. There was once I lost my car keys and I forgot where I put them. This created a lot of problems in my life and my family also worry about me.
excuse me, sir, but you are talking so much and not giving me a chance to talk. How am I supposed to help you? Right. So can I continue now?
Okay,
So you should increase the injection by 3 units every other day until your fasting blood sugar is maintained at 100 to 130.
okay. Oh, I see. You know what? My blood sugar level increased because of a famous dessert shop where I used to go every day. I used to eat many desserts in that shop, especially the famous chocolate lava cake with ice cream. You should try it too. Actually, I love to eat dessert very much, and the shop got sell different flavors of cakes such as chocolate cake, cheesecake.
Well. I think we are done here because there are many patients waiting outside. And I will call you by this week to see how it is working. Okay?
Okay.
Thank you. Next patient, please.
Continue on the communication issue based on our scenario. Okay, if we can see from the bad case scenario, there are a few communication issues between the pharmacy and also the patient. Number one, the pharmacist did not introduce herself. Number two, the pharmacist cut off the conversation of the patient impolitely. She also shows her impatience. She did not reassure her patient before educating him. She is not paying full attention at listening to him. The pharmacist also lacked caring and she seemed like she intended to finish her work as soon as possible. She is unable to control her emotion as she speaks rudely. She did not give some useful suggestion to help the patient to solve his problem. She also did not set the time limit for their conversation. And the last one, she ends the conversation without giving any advice. So all of these communication issues shouldn't be practiced in our real life. Okay, next, I would like to continue with the significance of unspoken involving thought and assumption. So basically, this part is about non-verbal communication issue that we can see from the dialogue between the pharmacist and the patient in the bad case scenario. So number one, the pharmacist interrupt the patient with an impolite way. Number two, the pharmacist just interrupt and explain the procedure with an annoyed face. And number three, the pharmacist just interrupt and explain the procedure by raising voice in a higher tone. Next, the barrier for effective communication. Okay, there are many types of barrier in communication. The first one is physical barrier. Physical barrier is the barrier that we can see from our eyes. For example, the distance between the pharmacist and the patient. So the distance between these two should be within 1 arm length. 1 arm length is start from here to your shoulder. It is 1 arm length. So if the patient and the pharmacist stay more than ideal distance, it can lead to mishear or misinterpretation of information. Means that the information cannot deliver to each other clearly. Second one is emotional barrier. From its name, we know it is involving emotion and expression. The next one is time barrier. Oh, this barrier is commonly involved in a hospital. For example, there are more patients waiting in line, and the pharmacist want to finish her work and leave as soon as possible. The last one is perceptual barrier. Perceptual barrier is the barrier involving what the pharmacist thinks and what the patient thinks. We should face all of this barrier with good communication skills to make sure the information can be delivered to the patient effectively. Next, the skill needed for pharmacists for effective communication. The first one is questioning skill. This skill will make the pharmacist able to gather more information about the patient and also to gain new knowledge. Second one is listening skill. This skill will make the patient feel that their voice is being heard and understood by the pharmacist. So to practice this skill is by facing the speaker and maintaining eye contact to them. The next one is explaining skill. A pharmacist should be able to explain the drug information in a simple language that can be understood by the patient. The next one is responding skill. A pharmacist should understand the patient behavior and try to respond and interrupt politely when the patient is talking. And the last one, this should be practiced in every pharmacist, which is empathy. Empathy is different with sympathy. Empathy is an ability to put yourself in someone else's shoes.
Good morning. I'm Agnes, a pharmacist who has been assigned by a doctor to provide you with some educational information on how to start and address the usage of insulin injection. Before I start our 15 minutes conversation, can I please know how should I call you, sir?
Hi, I'm Benji. Perhaps you have watched the movie called Benji. It's about a dog. That dog was super cute in that movie, and actually, that dog was trying to rescue two siblings, a brother and a sister. I just don't understand how that director could manage to train that dog. That dog was super smart. I tried to train my pet as well, but my pet doesn't even seem to listen to me. And
Oh my goodness, I'm so sorry to cut you off like this, but I just want to make sure whether do you feel uncomfortable in proceeding with this treatment? Are you okay with injections?
well, I'm actually not even scared of injections, and I don't even worried of being injected by insulin as well. And in fact, my mom was also a diabetic patient, and she was also being injected with insulin, and also my grandfather as well. So in my life, I've witnessed two patients being injected with insulins. So I'm not really scared of insulins being injected also. And in fact, I was diagnosed with having diabetes at the age of 51, I guess. But now I don't understand why youngsters are also being diagnosed with diabetes. I don't understand. Is it because of their eating habits or their lifestyle, or
Okay, I definitely want to hear more about when your lupus started acting up. But first, I want to address what concerns me the most. Since you had mentioned earlier that your mother and grandfather were also diabetic patients, we need to clarify a few things and then have a look at the procedure to inject the insulin. You can inject the insulin into 3 different parts of your body: your stomach, your buttock, or the back of your arm. You should inject the insulin into just one part of your body because each part absorbs insulin at different rates. So in your case, I would recommend that you inject into your stomach. You should rotate sides on your stomach each time you inject your insulin. You will be starting Lantus 10 minutes and will inject at night before going to bed. And
okay, wait. So now you're telling me that I have to inject at my stomach, is it? Oh my God, that is like super scary. I mean, why can't I just use the back of my arm or somewhere? It's like so scary injecting at my stomach. I mean, how am I going to contact that? Who is going to contact that for me? And how am I going to inject that? I just don't understand.
oh, there is still a small information that I would like to share regarding the Lantus. As I said previously, you'll be starting Lantus 10 minutes and will inject at night before going to bed and before taking your breakfast.
Oh, I see. Wow. That is like a lot of information for me to digest. You know what? I think I better set a reminder. I better write somewhere or anything because, as you know, I'm getting old and I keep forgetting stuff.
Yes, absolutely, sir. I would also suggest that you set an alarm in your mobile phone as a reminder. It would be much easier and systematic. Anyway, back to our previous discussion, you should pinch up the fat on your stomach and inject 10 units directly into this area and hold for 10 seconds to allow all of the insulin to go into the stomach. You should increase 3 units every other day until your fasting blood sugar is 100 to 130.
Oh, I see. Well, you know what? I think my blood sugar level increased mainly because of the famous dessert shop nearby my house. In that dessert shop, one of the most popular food, known as the chocolate lava ice cream cake, was my most favorite. I think you should try that as well.
Okay, sir. All right. I think we are done here. I will call you this week to see how it is going, and we shall continue our discussion then.
Okay then. Well, I've learned a lot from you today, and I really hope that we could meet soon for the next appointment. Thank you very much, and bye.
Bye.
So next we'll be proceeding with the alternative case scenario. The attitude of the pharmacist that is shown in the alternative case scenario is that Miss Agnes shows friendliness by introducing herself to a patient first. Actually, in any field of work, it is actually more proper to greet your patient or your customers first to leave a good impression in them. Miss Agnes also has a good time management where she will set a consultation time frame for all of her patients so that every one of them has an equal consultation time and the others waiting outside doesn't have to wait for a very long time. Miss Agnes also has good manners where she will apologize when she interrupts Mr. Benji. She shows her responsibility by making sure that her patient is comfortable with the treatment and she listens attentively to Mr. Benji, provide demonstration for a better understanding of Mr. Benji. She is also very considerative in the sense that she noticed that Mr. Benji is aged and an elderly person, so he might not know the medical terms used when she's explaining. Hence, she uses simple language by explaining to him so that he is clear with the explanation and has a better understanding on how to inject the insulin onto his stomach. The skill practiced by Miss Agnes in the good case scenario is that she has a good questioning skills where she starts off their conversation by asking open-ended questions such as the name of Mr. Benji so that he is more comfortable when he is communicating with her. Good questioning skill is also to inquire the comfortability of a patient regarding the treatment. She also has good listening skills where she listens attentively to obtain important information in their conversation, such as she noticed that Mr. Benji mentioned that his mother and his grandfather were also diabetic patients.
And Mr. Benji's daily visit to a famous dessert shop, which is the cause of his increase in blood glucose level. She also has good explaining skills where she explains the procedure in simple language to promote the medication compliance and her patient's compliance. She also gives demonstration for the better understanding of Mr. Benji on how to inject the insulin correctly into his stomach. She shows good responding skills where she responds when she needs to interrupt Mr. Benji, but before she do so, she will always apologize politely to Mr. Benji so that he is not offended by her act. She will also respond and give suggestions on the spot so that Mr. Benji realizes where his mistake is and he will correct it immediately. She also shows empathy when she is very considerate on her patient's forgetfulness, and she reminds him that he can put a reminder on his phone so that he remembers when to inject insulin.
In conclusion, a pharmacist should equip with all the necessary communication skills, including verbal and non-verbal communication skills, because both of them play an important role in achieving effective and appropriate consultation outcomes. Besides, to obtain more information from the patient, proper questioning and listening skills are necessary, as well as appropriate responding and explaining skills are important for an effective therapeutic outcomes. Furthermore, pharmacists should be able to control their emotion well and avoid showing unpleasant facial expression, because this will leave bad impression on them. The impact on effective communication skills is that it is essential to provide information and to educate the patient on the proper use of medication to ensure optimum therapeutic outcomes. Also, these communication skills helps pharmacists to build good rapport with the patient and to obtain trust and belief from them.